honestly does look like that. And it's all made in-house. And providers, if they want to.
Source. The constant debate Healthcare Institute struggle with. Chief Operating Officer, Apollo Gleneagles Hospital, India.
You have one unit.
Central Malaysia, and the topic is Designing Efficient Food Services case study by Dr. Bhuvaneshwari Shankar, Group Chief Dietitian Standards at Apollo Hospitals Group. So, Dr. Bhuvaneshwari. Food and Nutrition Department Manager, Chief Dietitian, St. Luke's Medical Center, one of our panel members as well. Mrs. Magdalene Chow, Assistant Director. Yes, because I think you mentioned the hospital right here. Is there anyone in there? And Mrs. Magdalene?
Yes, definitely.
You agree as well?
I think
Yeah, so we agree. The consumers are a lot more savvier today than even
something that's very challenging because food itself.
that I want to go into. I want to set the direction of this discussion.
Yes, and it's a welcoming
Or is
change.
it something you have to cope with and it's not a welcoming change?
It indicates that patients are reading more. I think it's both.
Yes, and it's welcome, but it's presented from their perspective. And my role here is, yes. So, does anyone have to share like a case that you like up here and you say what to do and I'm going to do it? I want to be a part of it. That's patient-centered. So when they
Okay, it's part of the motivational interview thing. You want to come to me, to my clinic and say, oh, you know what, Dr. Yan, and then at some point I say, hey, listen, if one, you have to go to school.
Would you consider that it's not a challenge, but it's
And we need to understand the patient's expectations when they use counters. They do see the dietitian what is the aspect of the session.
So you said
Evidence-based and scientifically proven claims of any of the food.
that patients come in with medical jargon. And so how do you deal with that?
This was diagnosed with this test was done, blah blah blah. In some
You need to update yourself.
We need to
Because
update
I'll
ourselves.
come to that point in a minute, Dr. Bhuvaneshwari, because I address that without getting frustrated. Yes, that's what you're saying. So, okay, Ms.
They Google it and they think they know more about it, but everything can be tell them in a nice way that they don't get offended. That's why now people think of more organic food.
Exactly.
Comes in and then they say that with medical jargon and everything and how 5 grams a day. So go and work out a diet, and she came back it was a day. So how many of you in the audience do that?
And then there's this thing about supplements or herbs that has helped.
So I think also what Magdalene has pointed out that we really need to understand where
And there is also this huge, as we know that in STEM, to a certain extent, so with the herbs and supplements, and so this is what I want to do. So how would you then deal with something like that? Do you get such
that's when the issue comes. So if I'm not clear,
Have you had anybody coming to you and this is not a very good way, but then there's so many people who come out. So when I look at him, I say, wow, in my head I was like, okay, we work very hard to get licensed, and I've never seen patients going to their cardiologist or to their
So that makes sense that you are a professional and you have your own information as opposed to food, which is something that is so close to everyone's heart, and life is more not so fun. And I would like mobile apps, isn't it? And so many, everything, you know. Do you feel in any time?
Ownership. So if a patient is interested and actually uses an app,
Is that more effective and more efficient?
I think it's more than what we have now available, like typically apps and how we
I still believe that, like you mentioned, something can technology.
patients, and there are actually a number of free software for some of you. One of them is called Fitness Pal. That one you need to buy. I think it's about in Malaysia who gets
Spoken, it has reached the apps.
So personal touch is very important, and especially for critical care. I just don't is there in mainstream where people are subclinically not well. So how do you then look at is that in that setting?
Whether what he's doing is right when he needs to reach a dietitian. Exactly. See, when you do something on your own, what other person is supposed
And sometimes you meet a dietitian along the way.
Out of the hospital setting and wanting to see dietitians and see them.
It's just to have that other perspectives on how nutrition works.
So moving on, very quick question that I wanted to address. Otherwise, it's not necessary. But then we have all these subclinical ranges.
For example, they are allergic to dairy products or whatever, and eat addition. And there is the question to say whether they are allergic.
You get all these food preferences from patients, and they are the ones who are actually helping the service department.
Would any of you would like to share?
self-claim allergies also. As you said, subclinical.
part of hospital, then we have to really practice evidence. When you talk about evidence, I can talk about evidence. So I know what I'm speaking about when I lie, you take heart, make you feel good, do it, but it doesn't come from here.
Coming to time. So I would like to open the floor to questions. Anyone?
Dietitians because we are talking about consumers better.
Not really, and who want to take ownership and want to come to you as an
I
individual.
noticed that the dietitians in Malaysia are not very engaged.
You know, the question is not about political engagement. The
No,
question
it is.
is setting. Yeah, that was the question.
Because dietitians have a platform. Yeah. Now there are a lot of people wanted dietetic advice.
I don't know about Singapore, but in Malaysia, dietetic doesn't have much platform.
Do you mean we do go for corporate talks?
And that is the problem that I feel there are gaps as well, right? And
By ADA, that much is not happening in Asian countries.
You have to work by a team-based approach, and to access a dietitian, you need to go by.
you have to be hospital.
So it needs to be that. Hey, maybe you need to get your doctor to refer you to see a dietitian.
Anyone with a question?
But
Yes.
can I comment on that? I hope we will.
Yes, maybe it's more of the patients, but our consumers can also be.
Sometimes provide us with credible and accurate nutrition information.
Well, I think in India, you managed to get 160 dietitians there. Resources. In America, there's a lot of dietitians there as well, whereas we don't have, so we make do with.
Take charge of the nutrition when they come in, and I think that's a very, very local settings as well, which is not happening, and that's where I personally.
But on the I agree. I think Apollo Hospital is very, very. So you see, you have different standards, and we haven't arrived.
I liked it, and this has been a very interesting. I hope you all have enjoyed the debate as much. It's interesting, and thank you so much for all the panel members for sharing.
How about this camera
It's a
first?
1 hour and 15
This camera.
minutes lunch, so there's